Do your legs hurt even when you're not doing much? Or do you feel a deep ache when you walk? Or sometimes get a sharp, strange like of pain running down your leg? If yes, you're not alone. Leg pain is one of the most common complaints that I see in my practice. And people usually say, Doctor, it's probably just tiredness. Or I thought it was normal because I sit or stand a lot. But I'll tell you the truth. Not all leg pain is harmless. Sometimes your body is trying to tell you something important. It could be your muscles, your nerves, your veins, or even your arteries. And in this video, I'll explain the most common reasons behind leg pain, how to recognize what type of pain you are having, and when you must take it seriously. Ignoring leg pain for too long can lead to bigger issues ranging from nerve damage, weakness, blood clots, or even amputation. So let's start by understanding what kind of pain you have. So the first part we will talk about muscle related leg pain, which I believe is the most common form of leg pain. So if you have noticed that you started walking around more, joined a gym recently, stood for long hours, or even went for a trip, chances are that your leg muscles are overworked. And this pain usually feels like heaviness, soreness, or stiffness. And it may be felt in both the calves. Even the thighs sometimes can give pain, and this would get worse at the end of the day and usually improves with rest, stretching, or applying a warm compress. I have even seen that in younger people or those who have just started to exercise. This can be one form of muscle soreness. But additionally, because the muscles are not used to so much work and they are actually reacting to the extra load, and this may be much more in someone who is overweight. Additionally, dehydration or lack of electrolytes like potassium and magnesium can also make the muscles cramp or make them feel tired faster. This type of pain is nothing to worry about, and it goes away with rest, gentle stretching, and staying hydrated. Even a few anti-inflammatory medications that you take for a short time can be very helpful in this. But if the pain doesn't reduce or keeps coming back, then it may be some other reason. The second part, we will go on to nerve pain, which is often ignored but again a common cause of leg pain. If you feel that the kind of pain you have is a very sharp, shooting one, starting from your back or a hip and traveling down towards your leg, that may be kind of a radiating nerve related pain. This is commonly caused by a condition called as sciatica, where in your lower back a nerve gets compressed or irritated. People feel that they should have back pain and leg pain. Some people may have only pain in the leg and nothing in the back. And they often describe it as burning, tingling, or electric-like sensation. And sometimes people notice that the leg feels weak or numb. The most common reason for nerve pain is a slip disc or a spinal canal stenosis. And sometimes even poor posture from long hours at a desk or standing can aggravate this pain. Now, nerve pain is different from muscle pain because it will not improve very much with rest or massage. In fact, if you sit for too long or stand for too long, the nerve pain may actually become worse. So, if you notice that the pain travels along a line or your leg starts feeling weak or numb, then do consult a nerve doctor, a neurologist, or a neurosurgeon and get it diagnosed in time. Early identification and treatment can help prevent permanent nerve damage. Coming to the third cause of pain, which is vascular pain, that is when your blood vessels are the problem. Now, this is one of the most overlooked causes of leg pain, especially in people above 40. And that's where vascular surgeons are helpful. Your legs have arteries that will supply oxygen-rich blood and veins which are used to carry the blood back towards your heart. When these blood vessels start having problems, then pain is one of the earliest symptoms to happen. And talking about the arterial component or the arterial cause of pain, if you feel that the leg pains on walking for a certain distance and goes away when you stop and rest, it could be a sign of blocked arteries, which in medical language we call as peripheral arterial disease. It happens because there's a plaque or atherosclerosis which causes narrowing of your arteries. So when you walk, your muscles need more blood supply, but these blocked or narrowed arteries are unable to provide enough blood to the muscles, and that's when the calf or the thigh muscle may feel cramping. Some think it just tiredness, but it actually can be a warning sign, because if you do not diagnose it at time, and the blockage, if it gets worse, still further reduction in blood flow can lead to ulcers, dark patches, gangrene, and even end up with amputation. Now let's talk about the other blood vessels, which are the veins. And in this, what you will see is that the legs start feeling heavy, tired, or swollen at the end of the day. Some may even notice visible blue or purple veins called varicose veins. This essentially happens when the valves in your leg veins become weak. So the blood, instead of going from your legs towards the heart, starts pooling or collecting in your legs and muscles. So over time, this may even give rise to skin discoloration and ulcer. And typically, vein-related leg pain is not very severe. It would be worse when you stand for longer hours, and it reduces when you elevate your legs. And both artery and vein problems need proper medical attention. They will not improve with just home remedies and painkillers. Coming to the fourth kind of pain, which is joint pain, which especially happens around the knees and hips. So people who have pain in the knee or around the knee, sometimes it may not be just the bone, it may be the muscles or ligaments around the knee. And you would notice that there is pain, especially while getting out of a chair or walking for a longer time or even climbing stairs. Then this problem may be in your joints, and osteoarthritis is one of the most common causes of joint-related pain in people over 50. What happens is that as the cartilage in your joints wears down, the bones lose their cartilage protection. So this will lead to stiffness and discomfort. This kind of pain is usually dull and deep, and sometimes there may be associated swelling. Some may even note some amount of cracking sounds or may find it difficulty in moving the joint. In these patients, physiotherapy, weight management, and anti-inflammatory treatment can help to reduce the pain and improve mobility. Some of them may end up needing some interventions or surgery by orthopedic doctors. Now comes an important question. Can leg pain become a medical emergency? Well, if you pay attention to these 4 signs, you will understand when leg pain needs immediate medical attention. The first is if your leg suddenly becomes swollen, red, and painful to touch. You might have some signs of blood clot, also called as deep vein thrombosis. Secondly, along with increase in the severity of pain, you notice there is numbness, loss of toe or foot movement, or inability to bear weight. Then it could point towards a severe nerve compression. Thirdly, if you experience pain and you notice that the foot becomes cold, is pale, and reduced movements, it may point to a sudden artery blockage called as leg attack. And lastly, if along with pain and redness you start having fever or sometimes blisters, it could point towards an infection. So these are symptoms not to wait and watch. These would need urgent care. Along with these common causes, sometimes there are other less common causes of pain also, which may be vitamin deficiencies, especially with vitamin D or B12. There may be issues like flat feet, hormonal issues like thyroid problems, or sometimes side effects of certain medications. In women, pregnancy and hormonal changes also lead to water retention and vein pressure, which can give rise to some amount of leg heaviness or pain. And that's why it's important that a full diagnosis is important before starting any treatment. And what works well for one type of leg pain can actually make the other type worse. So the next time your legs hurt, don't just blame them on age or tiredness. Ask yourself, where is the pain exactly? What kind of pain is it? Is it dull, sharp, shooting, or cramping? Does it get better with rest or movement? Does it happen only after walking? Your answers can give you powerful clues about what's really going on. And remember, while some causes of leg pain are harmless, others are silent warnings that your body needs attention. And in this video, I have shared some of the best exercises that can help relieve your leg pain. You wouldn't want to miss that. Stay active and stay informed.